Hi, I'm Christy Henderson and I'm from ACTEON. Forget that. Hi, I'm Christy Henderson from ACTEON North America. Today I would like to talk to you about the Newtron B.LED XS. This is a unit, a piezo unit with an external water reservoir. Before I get started, one thing I would like to mention is that we were the inventors of piezo ultrasonic technology. That's something that I'm really proud of, to be able to represent a product that we were the inventors of. There are a lot of benefits with using a piezo, and I'm just going to name 2 or 3 of those today. First of all, there is less water. 50% less water when using a piezo. And I want to show you, you can see right here, I'm showing you exactly, do you see just the little drip? In fact, we could actually even back that off just a little bit to right there. That is all the water that you need when you use a piezo, and here's why. There's not a stack that you're having to cool. You're not having to cool the handpiece. You're actually just having to cool the tip. Here's the benefit of that is your patients enjoy it much more, enjoy their cleaning much more because it's less water. You as a user, whether you're a dental hygienist or you're a dentist, will like it because your visibility is going to be greater. Another benefit to piezo is the tip movement. The tip movement works in a linear movement. It hugs the tooth and it hugs the root surface, and there's no banging. The tip does not move elliptical. It's a linear movement, so it's much gentler to the patient. I've had several hygienists that have purchased this unit and have pulled their patients, and they always tell me that their patients notice a huge difference when a piezo is used on them. The other difference, and by the way, I'm a dental hygienist, the other difference that, or the other benefit with using piezo that I think is just absolutely incredible is that the handpiece does not have any vibration. And here's why that's so important. You are able to keep all of your tactile sensitivity when you're working subgingivally. So when you're doing the tough prophies, you're doing your SRPs or your perio scale, when you're on that root surface, your tactile sensitivity is not hindered in any way, and you can actually feel everything under the gum line. Which brings me to the last benefit, which I think is huge. Being a dental hygienist and having practiced many years, I think this is just a huge benefit to the hygienist. If you have the proper amount of tips, and as you can see, this will hold 4 tips, and if you have 3 to 4 tips, you can really clean most any patient's mouth. The reason why I want to point this out is that if you are using more than 1 tip and you get the right tips, hygienist, if you are seeing 8 patients a day and you're using a piezo with the correct tips and you're using this as your tray setup, you are going to do 8 cleanings or 8 procedures a day. You're going to do 8 prophies. Now, let's say I was using another type of technology, for example, magnetostrictive, and I asked you, you said, and you told me that yes, I see 8 to 10 patients a day. Well, if you're using a different type of technology and you're not using the right tips, then you are actually doing 16 to 20 prophies a day. So I ask you, which technology would you prefer? Something that makes you work a lot less harder, and is actually gentler on your patients, the treatment's actually gentler, or would you rather do twice the work than what you need to? Also, I would like to mention that piezo has many functions. You can use it on obviously cleaning teeth, perio scales, or SRPs. Doctors, you can use this for your endo. It can be used for retreatment and it can also be used in some restorative situations. Thank you so much for your time.